Hey, what's up YouTube? What's going on? Coach Remi here, helping you fix your back pain. Today we're going to be talking about how weak glutes can affect low back pain. When it comes to weak glutes and low back pain, we need to understand the function of the glutes. So we have three gluteal muscles: glute max, glute medius, glute minimus. Glute max making up 2/3 of the whole gluteal complex. And they're responsible for hip extension, hip abduction, and hip external rotation. But they are also play a very important role in stabilization of the low back and the pelvis. And so if someone doesn't know how to use their glutes properly, or there's a weakness there, that could lead to compensation, and that can place more force on our passive restraints, in particular our discs or joints. So when I'm working with a low back pain client, one of the first things I'm looking for in terms of assessment is how are they using their glutes, and do they actually know how to use them, and what is the overall endurance and strength of them. So I want to show you guys a couple assessments here that I'll use, and the first assessment is just a single leg balance assessment. So what I'll have is one person lift their leg right up, and from this position I want them to hold it for 10 seconds. And what I'm looking for is the angle of their pelvis. Are they on an angle? Are they falling all over the place? Or are they able to kind of just keep a straight line through their pelvis? Now, if they can keep a straight line through their pelvis here, then that would be an indication that they probably have good stability through their gluteal muscles. But if there's a angle that is involved and they're leaning all over the place, that would be an indication that maybe glute medius specifically, there's a little bit of a weakness there that we want to focus on. So that's the first assessment. For our second assessment, we're going to be doing the glute bridge. And when I first work with a back pain client, I'll ask them if they've ever performed a glute bridge. And if they haven't, then that's probably an indication to me that they may not know how to use their glutes properly. But what I'm going to have them do is they're going to lay on their back on the floor. And for the glute bridge, they're just going to lift their hips up while focusing on squeezing their butt and pushing through their heels. Now, what you'll commonly see with people in terms of things that I'm looking for in terms of mistakes is that people may perform this with a small range of motion. They may only lift their hips up a little bit off the floor, and they're not actually working or really feeling their glutes work at all, and they're putting a lot of stress on the low back. That's issue number one. Number two is people may have their feet too close together, and that could put a lot of stress onto the quadriceps instead of the actual glutes themselves. So quick fix there is just to go a little wider with the feet, pop the hips up, squeeze your butt. Now everyone's anatomy is going to be a little bit different. We just need to pinpoint what feels best for the individual. And then the third issue is that people will hyperextend and really get their hips up almost too high, where they're placing a lot of stress onto the low back and really kind of cranking on the facet joints. So that's the glute bridge assessment. Now, for someone that maybe is a little bit more advanced, what I'll have them do, and if they kind of knock the glute bridge out of the park, is we'll perform a single leg glute bridge. So for the single leg bridge, all we're going to do is we're going to go hips up. Now from this position, I'll just have the individual kick one leg out and then hold that, or try to hold it for 10 seconds. Now what you'll commonly see happen with some people is that they may start cramping in their hamstrings, which may be just an indication that the glute that they're stabilizing on is a little too weak, or they're pushing their heel into the floor too much with the toe upwards. So they're in this upward position. So you want to make sure the foot is flat to the floor. Another issue is that once the hips are up, what you may see is the hips will kind of drop right down, which would indicate there's some rotary instability there that we would want to focus on. Or the third thing is that there will be certain muscles that will compensate to stabilize for the glutes maybe being weak, not functioning properly. And so I'll give you an example. As you go with the hips up, now as I kick the leg out, the hips, what you'll see is the hips may drop in some people, then pop up. So what happens there is that we're going into a little bit of a hip flexion before we're popping our hips up, and that would indicate iliopsoas is playing a role in stabilizing there and not so much the glutes. So to correct that, it may be that we need to actually just focus on developing that glute more, or it may be just a cue to the individual to say, hey, you know, make sure your core is engaged, and to kind of just tap them on the side of their leg to cue them to really just fire that glute a little bit more and really focus on more of the mind-muscle connection. So that would be the single leg glute bridge assessment, and that may be the third assessment I'll use with somebody just to assess the function of their glutes. And then from there, from the results that we get, we can then kind of put a program together to address any weaknesses or imbalances that we may see. And so some exercises that we may use to address that would be just, we'd grab a mini band, place it around our knees, and go side steps, or we can just use the exercise, the glute bridge itself, play with different reps, sets, loading schemes for that exercise to kind of just really address the development of the gluteal muscles. So that is how I may assess somebody for weak glutes and how it can affect the overall biomechanics and compensation of the low back and pelvis, because the whole idea, like I mentioned in the beginning of the video, of the glutes is they're playing a stabilizing role in the whole lumbopelvic region. And if there's a weakness or imbalance, certain muscles may compensate, and we may alter the way forces are placed onto specific tissues where we don't want, specifically maybe our discs, joints, ligaments. So we want our muscles doing the appropriate role that they were intended to do. One final point, guys, I just want to go back to the glute bridge assessment for a second. And when I was talking about when someone lifts their hips up, if they don't get full range and they're only about halfway through the range of motion, that's putting a lot of stress on the low back. But why this is important is because that's an indication that that individual probably has never really learned or understood how to actually use their gluteal muscles properly. So when it comes to performing everyday tasks, such as if you're grabbing a box and you're lifting it overhead, what you'll see people often do is that they'll fall into lumbar extension or even hyperextension under load, and they'll keep repeating that for cycles. And that can lead to a back issue developing. But if someone was taught to use the glutes properly by just bracing and squeezing their butt, that'll help put the back into a better position, and it'll limit the chance of them dropping into any extension pattern. So that's an important reason why we would do the glute bridge assessment, and how that would have an important carryover to understanding why someone may have back issues in the first place. All right, thanks for watching, guys. I hope you guys enjoyed the video today and were able to pick up a few new tips, and hopefully the assessments can provide you with some insight about maybe what's going on with your glutes. And if you're really unsure about what's going on, seek out maybe a physical therapist or personal trainer to actually kind of specifically maybe give you a detailed assessment. So with that being said, guys, if you want to see more back pain tips, be sure to subscribe to my channel. And if you enjoyed the video, hit that like button. Okay, guys, all the best. Have a successful and productive day. Take care.